Hello, I am bringing you this video as a response to your fishbowl questions. I know it's a little bit later. I was hoping that I'd have enough time to get it in before the semester ended, but with such a short semester and a quick turnaround time with grades, it just wasn't possible. And then we got hit with the 4th of July holiday. So I found myself saying, well, I'll get this to them, but it's going to be a little bit late. I was really happy to see that a few of you did ask questions. And so in the email, I did outline here are the questions that I'm going through, and I'm just going to go through them one by one. And I love the questions. I thought they were really great. So without further ado, the first question was, is it possible as a girl to not be able to have an orgasm? Also, how do you really know when you have one? And the follow-up question was, I have a boyfriend and we've been pretty much engaging in penetrative sex, oral sex, fingering, and this person has done some research around that. So this is a good question, So is it possible for me to have an orgasm? Now it's always important to remember that there could be some medical issues happening that could prevent somebody from being able to have an orgasm. There could be damage to nerves. There could be issues with emotional functioning, cognitive functioning. Remember, everything is connected when we think about sexuality. So it's not just, if I apply pressure here, I'm going to have an orgasm. Kind of everything needs to really be working together, mind, body, spirit, so to speak, for us to feel like we can get there. So when I think about this question, I think, well, I would say that the chances of you being able to have an orgasm are probably pretty good. But it's just about learning about about your body, learning about what feels good, and also when we put a lot of pressure on getting an orgasm, the expectation, the anxiety, the stress, the pressure definitely is going to impact your ability to have an orgasm. So, the second part of the question says, I've tried on my own too with a vibrator and such. I just don't think it's happened. So, when I think about this question, I think if you're struggling to have an orgasm, and this person's asking from a female perspective, I would say what you want to do is before you go down the path of like, I'm going to go get a vibrator, I'm going to apply it right to my clitoris and hopefully I get an orgasm, is, you're looking at the end result as the main event, as this is the thing that needs to happen. I would scale it back. I would say spend some time by yourself, masturbating, but also I would say spend some time just touching yourself, all over genitals, your body, what you find to be exciting, sensual, relaxing. And when you go and do this, don't think of it as I'm trying to give myself an orgasm. Think of it as I'm just seeing what feels good. Now, an orgasm may happen or not. But I would say take the pressure off of needing to have an orgasm, because right now it seems like all the pressure is around getting to have this orgasm. So with that much pressure, it's probably not going to happen. So I would say touch yourself manually with your fingers if you want to use a vibrator, but start slow. And I would say also do some reading up on that. What does it look like if I'm just kind of learning about my body, learning about what touches feel good, where areas are sensitive, and that sort of thing, and build up to it. Because you need to know what works for you, what feels good for you, prior to really being able to direct your partner. So that would be my best advice for that one. One, do I think you're probably able to have an orgasm? Yes. But right now it sounds like there's so much pressure around getting it that's really influencing the ability to get there. So scale back, do some work by yourself, take the pressure off yourself of really getting there and really focusing on learning about what feels good, what works for your body. And then hopefully over time, and as you relax, you can get there. And the other question in there was, am I going to know? And and some people say yes, you'll know. And in terms of what it's been described as is an orgasm is physiologically described as and physically described as involuntary contractions of the vaginal wall, right? But it also sends, kind of explosive type feelings and travels throughout your nerves and your body. So yeah, the experience certainly can vary for everybody, but it's typically like between 7 and 20 seconds, where you get like this kind of like explosive feeling of nerves. It's not like to where you can't think or see straight, but it definitely separates itself from just feeling aroused to then orgasm. So I hope that answer helps. So the second question is, for someone that has never had sex, I want to know if it's possible to get pregnant using a condom. I have a boyfriend for a long time, and we are afraid because we never know if using the condom is 100% preventing pregnancy. This person comes from a culture where birth control pills is not something you just ask your parents to schedule a doctor appointment. But also sex is like in this culture really only happening when you're married. So to seek outside resources around contraceptives may be considered taboo. So are condoms 100% preventative? No. They are a great method. However, condoms can break. You know, you could not be putting it on correctly. You know, for some reason, depending on if you're fooling around prior to the condom coming on, there is sperm in pre-ejaculate. So if you find that stuff comes out of the penis, that's like a lubricative feeling, it's not ejaculate, but it is pre-cum. People say, oh, there's no sperm in pre-cum. That's false. There absolutely can be. So if you're rubbing genitals prior to the condom going on, a sperm can travel. And then if you're having penetrative sex after that, that could help it, further along its course. You can look it up in terms of what's the effective rate. It's a pretty high percentage, so it's a really great method, but no birth control is 100% effective. The only birth control that is 100% effective is abstinence, which is abstaining or not having any penetrative sex. So that's your 100% go-to, but if you're interested in having sex, you're going to want to look at other options. So it's also important to know that you don't have to go to your parents, that you can go and make a doctor's appointment on your own, and that is completely confidential. So if you want to have access to birth control, like using a pill or some other hormone-based contraceptive, you can access that without having to speak with your parents. They don't have to know about it. It's your personal, private matter. So feel empowered with that. If you are having sex and you want to have, the pill and a condom to feel really safe, go ahead and do it. So just like you're not asking your parents to use condoms, you do not have to ask your parents to use hormone-based birth control. So you have absolute access to that without them having to know, because we have a thing called HIPAA in the USA where you are protected. And the only person that has access to your information is you and any other person you grant access to that. So I hope that maybe helps with that question. Okay, so this is a really great question and usually comes up during the class. What does it mean for a female to squirt? Is that something that all females can do? Is it something that a partner can make the female do? What is the liquid and where does it come out of? So what does it mean for a female to squirt? So this is considered female ejaculation. And this typically happens when a woman is stimulated and has an orgasm due to the G spot being aroused or stimulated. So, in one of the lectures, hold on, technical difficulties. All right. In one of the previous lectures, I think in female anatomy, I discussed that the G spot is located. So if you take two fingers and insert them into the vagina up to the second knuckle, and then kind of do like a come here motion, right? So the pads of your finger are basically rubbing up against what would be considered the G spot. And what is the G spot? It's actually like basically tissue. So it's not like the clitoris, which is like this like fun little knob, right? Which you can easily see and detect and touch. The G spot is it's a unique type of tissue with unique nerve endings that's located in a particular spot inside the vaginal canal. So with that being stimulated, it causes the contraction in the vagina and in the pubic region, right? Which what happens is it actually contracts the bladder. And what happens with female ejaculation is when that type of orgasm contraction happens, the urine that's in the bladder actually comes shooting out of the urethra, or the hole in which you pee out of. So one of the things that I would suggest is, if you're interested in either doing it to yourself or with a partner, is pee. So empty your bladder, and if you're gonna, try this out, the first thing you want to do is pee, empty your bladder. I mean, you don't necessarily have to, but it'll be a little messier if you don't. Put a towel out and work on, trying to stimulate that part of yourself or for your partner, and you'll find that brings kind of like and it's said to be a higher level, more intense type of orgasm. So yes, females can squirt, and it's considered a female ejaculation by stimulating the G spot. It's a more intense level orgasm that contracts the bladder, and basically urine shoots out of the urethra, or whatever is in, the bladder at that time. So that's how to describe that. And also know that this is one of those things, as you learn about yourself, as you become more sexually intelligent on a personal level by yourself with your partner, that it's something that you can try and become more comfortable with together. All right. The next question is, I was with a guy once that would never really ejaculate while having penetrative sex. He would only be able to if we were in one specific position. Is that normal, or was we doing something wrong? So, this would be, sometimes I get these questions and I think, I want to ask more questions. I want to know more. But when I hear this, I think about, okay, so this guy was only ever able to ejaculate while he would never ejaculate while having penetrative sex. He would only be able to do it if we were in one specific position. So, depending on how this works, it could be that this person had associations around one specific position being the most exciting, the most stimulating, and that would get him to a place where he'd be able to have an orgasm or ejaculate. So, oftentimes partners will figure out okay, well, when we get to this position, we know that this is going to be the end of it, because this is going to make me come. So certain positions, you can last longer in. Other positions are more stimulating, more exciting, and you're going to probably have a higher chance of of coming. So I don't think that this person's asking, was I or we doing something wrong? So I don't think it's fair. I don't want to say that the person who's asking this question, you were doing anything wrong, because it sounds like the person you were having sex with could have like some sort of situational or orgasmic issues going on. So, and again, I would need to know more about this. But it's like when if I talk to someone and they have issues like I'm having trouble ejaculating or that sort of thing, I'll ask like do you masturbate? Can you have an orgasm when masturbating? Can you have an orgasm during sex? Is it all the time or is it situational? Sounds like there's something happening with this person that's situational, that would need to be explored more. I don't think that anything is wrong or incorrect or anything like that. It sounds normal, but it sounds like there is something situational happening for this person, where maybe other things that happen in sex are less exciting. There could be use of porn. Porn. We can all have different opinions about porn, but porn does actually affect your brain chemistry around sex, around orgasming. So that's something to be aware of, that if you're masturbating and orgasming to like really really intense pornographic erotic images and videos, that sex with a partner in the real world can be less exciting, actually can affect your ability to have an orgasm because you're needing these really, really intense visual imagery to have an orgasm. So that's something to think about if you do watch porn. That's the best way I can answer this question without really knowing more about what's going on. Okay, so I know there is no such thing. Next question. I know there is no such thing as normal with sex. Really, I'm a woman, but I really don't like penetrative sex. I love everything else, like the initial penetration, but after that, I'm not really into it. I usually end up being sore. Is there any way I can enjoy penetrative sex more? So, a couple things with this one. So, typically with younger women, as you age and get older, your satisfaction, your enjoyment of sex does increase because you become more connected with your body. You learn what works for you. You can be a little bit more directive with your partner around what works, what doesn't work, and in terms of just feeling more relaxed in the process. So, I'm not sure if this person is experiencing tension or anxiety during sex. If you experience tension or anxiety, typically you have a constriction of your muscles, and the vagina is one big muscle. So if you're having penetrative sex and all of a sudden you're clenching your vagina, you are not gonna enjoy it, because that's gonna begin to hurt, right? So you're squeezing that muscle and then something's trying to go in there. That's going to be painful. So if you're experiencing that, you're not going to be enjoying it. Now, I would also be curious to know what your partner is doing. So is your partner, in terms of the pace of sex, is bang bang bang, rabbit sex, that would be painful over time. That would definitely increase soreness. So I would wonder about what is the pacing looking like? What positions are you using? That are any of them better or not? Those are things that I would, are you communicating about that while having sex or before or after? If there is something that is working, are you continuing that? So those would be things, I would be curious about. Could be a lubrication issue. So, maybe you're not, because if you're feeling anxiety or feeling tension, you're not producing enough lubrication. If you're not lubricated, it's gonna hurt. So maybe you need to get some lube. So I guess again, some of these questions I can answer to a degree and generalize because I only have so much information. But those would be some things that I would definitely consider. Okay, next question. Is it possible to still be sexually aroused during intercourse when you're a senior? by senior, I mean 65 years old and up. And I'm wondering because when I'm old, I'd still like to make love with my hubby. So my answer to this is, and we also did talk about aging and sexuality in the class, is yes, absolutely. So here's what I know about as we get older and sex. As long as people are alive, they are having sex. Now, not every person is having sex, but you ask people in their 80s if they're having sex, they'll say yes. Um, so, if someone is still able to have an erection, we have, KY, jelly, lube. So women don't have, even if women aren't able to produce lubrication on their own, they have resources. Um, so yeah, absolutely. Oftentimes couples who are, later in life will say, this is the best sex we've ever had because, we're so incredibly comfortable with our bodies. So we're really able, to enjoy what we're doing. So yeah, as long as you're, alive, you're able to have sex. And also it's important to remember that sex isn't just penetrative sex, that being sexual with yourself, with your partner, that's a lifelong thing that you can enjoy. Now, it is important to say that our abilities, our capabilities around sexuality will change over time, and that's important to consider. So, what you might have been able to do at 25, you may not still be able to do at 65. But that's just part of the aging process. All right, so this is the last question. If a woman masturbates too often, can she still climax from sex with a partner or other form of sexual activity? Someone once said that another girl masturbated so often that she could only get off by herself. All right, so this is a good question. So if I masturbate at 2 o'clock and I have sex at 4 o'clock, can I have an orgasm? Yes. So, one of the things that we learned about with the sexual response cycle was this with the end, this refractory period. Men have it, women don't. So there is actually a point for men where they are unable to reach orgasm right after having an orgasm. Women, that actually doesn't, it is not the case. So women can experience multiple orgasms in a row, whereas men can't. So that's kind of a neat thing. And the other question that I hear in here is, this person masturbated so often that she could only get off by herself. So what this is more about is it does take practice and a comfort level again with being able to have an orgasm with a partner. When you masturbate, you learn about what works for you. You're able to control whatever is happening, right? Versus if you're fantasizing or watching pornography and stimulating different parts of yourself that feels good. Like, you can manage all of that by yourself. When you include a partner, you include this whole other experience, a part, right, of that. So, yeah, have I heard that, yes, I can masturbate myself, but it's very hard for me to come when a partner is, giving me oral sex or having penetrative sex. And, that for me is really hard. That really speaks to issues of comfort, issues of anxiety, feeling safe in those situations where you can relax enough, where you can allow yourself to get to those places, versus when you're just by yourself. So I'm gonna say it's you're never at a place where, like, could you be in a place where you're masturbating and really finding it difficult to have an orgasm with another partner present? Yes, but it takes work. It takes exposure to that, talking about it, learning about yourself, and working on that over time to include the partner and feeling comfortable and feeling relaxed. So you're not going to necessarily get stuck there, but it's part of growing as a person, growing as a sexual person, growing in your sexual identity, and doing those things. So, like, kind of similar to the previous question about this, this guy could only um, have an orgasm with this one specific position. Um, Again, that could be something too, where that person's sort of like stuck with this is what makes me, have an orgasm versus, okay, now, expanding that and being more inclusive to the partner and doing some work around that. So that was another, I think, really good question. All right. So those are the questions that I received, and I hope that these answers were somewhat helpful. I guess I do want to say to you all in person, um, thank you for a great 6 to 7 weeks. It was really awesome to read the discussion post. Your reflection papers are always, for me, like, really, really great to read. My research interest is parent child sex education. So it's always very validating to hear from you all around, here's what I experienced and here's what, would have been helpful for me, and knowing what I'm, really trying to work on. It's validating and gives me encouragement for what I'm doing. I hope you all had a really great semester. I hope you learned things. And I am on campus. So if you would ever like to meet me in person or ask me questions or follow up in any way, I'd be happy to meet with any of you one on one. So even though this class is over and I'm no longer your instructor, please know that I am a resource for different conversations around this class or grad school or whatever. So, again, thank you so much and enjoy the rest of your summer.